Well, it gives me great pleasure to bring Dr. Rosemary in the morning. I think, this will be not in the morning. No, this is still in the afternoon, but we are going to mornings very shortly. So this is still in the afternoon. And Dr. Rosemary's one busy dentist. She does such good work, though, and you will enjoy listening to her enthusiasm. It's funny when you think about, first of all, female dentists, which I never really knew any, and now to find this woman who is so excited about helping you with your oral health. So welcome to our show, Dr. Rosemary.
Thanks, Anita. How are you doing today?
I am fine, thank you, and I think there's so many subjects that we need to cover, but one of them is we never think, someone may say, well, I'm going to have to go get a filling in my tooth. And why is that people even need fillings? What happens?
Well, they get cavities sometimes. Sometimes they may get decay, and they need to have their tooth restored. Or they may break a part of a tooth, or a filling may break. So we need to, at that point, restore the tooth. So when we have to restore the tooth, there's several options. We can do different things. We can either restore it with something we call, either we can do it with something called an indirect restoration or something called a direct restoration. And Anita, if I get too technical, you'll let me know.
No, but I sure am interested in what the difference is.
Okay. An indirect restoration is something that usually requires 2 or more visits. So at the first visit, you would go, and the doctor will prepare the tooth, meaning they will cut down the tooth a little bit, they'll prepare it, they'll take an impression, may or may not make it temporary for you, depending if you need it. And when you go back for your second visit, they'll then get the restoration back from the laboratory, and they'll cement it onto your tooth with a permanent cement. So that's an indirect restoration. What are the kinds of indirect restorations there are? There's onlays, inlays, veneers, crowns, bridges, and what you need as far as an indirect restoration depends on which tooth it is, what exactly happened to the tooth, what your goal is in restoring the tooth, what your ultimate goal is. So to just give a quick answer, what's the best thing for me? It's hard to say. Is it a front tooth? Is it a back tooth? Is aesthetics important? So there's a lot of things to consider. There's gold we can put on the tooth. So there's a lot of things to consider when considering indirect, because there's so many options. There's just a whole plethora of options of what we can do for a tooth.
Well, I don't want to jump ahead, but I know that years ago I had silver fillings, and for some reason now silver fillings are not appropriate, and people have said, I don't think I have them anymore, but some people get rid of all their silver fillings. Will you explain all that?
Yep, that's my next topic.
Okay.
That is called a direct restoration. What's a direct restoration? A direct restoration is a filling that's placed in the tooth the same day. So you'll come in, maybe your filling broke, but it's not a huge filling. So maybe you don't need to have an indirect. We don't need to take an impression. We don't need to send it to the laboratory. You don't need to have it done cemented in the next time. So what do? We just take out the old filling and we put a filling in that same time. So it's all done in one visit. It's directly placed into the tooth. There's one of 2 types of direct restorations usually, either amalgam or, as you said, silver filling, or a composite filling, or what we know as a white filling. Now, amalgam, or silver, has been used for centuries. That's one thing to just clarify. A lot of dentists do not use it. Yes, an amalgam gets such bad rap. I mean, every time you watch the news, every time you hear something, they're talking bad. Even yesterday on Dr. Oz, they were talking bad about amalgam, that, amalgam causes fatigue and brain fog. So, you always hear something about it. Now, just to clarify it, amalgam is it's approved by the NIH, the World Health Organization, the FDA. If there was any danger in silver fillings, it would not be on the market. So, it's not all the silver in there. It's a metal combination, what we call amalgam. Because what is amalgam? Amalgam, the definition, is like a mixture. That's what amalgam really is. It's a mixture of different metals, of silver, tin, copper. So it's not that there's so much silver in there. It's a combination of all of these things. For a back tooth, Anita, and my mouth has tons of them in there also, for a back tooth that has a big, big filling that you're getting so much heavy chewing forces, an amalgam of the two options, whether it's amalgam or a white filling, amalgam is definitely a better option.
And why is that?
Why is that? Because it's so much stronger. It's much stronger than a white filling. No question about it. Now, do I do it in my office? No. Why don't I do it in my office? Because none of my patients want it. There's no demand in my office. When I was working in New York, last year, I did tons of amalgam. There was a lot of demand in it. There's a lot of demand because a lot of the patients up there, they're up there, it's different. They wanted it there. It's a different type of, the patients, they're educated in a different way, and they understand that, and the dentists also educate their patients differently, and they understand that, for back molars, sometimes it's the best treatment of choice. I've had patients that had white fillings when I was practicing in New York City, that when they had back molars with white fillings, that those white fillings would break, and then we would take them out, and sometimes we would put silver fillings. So I think practicing dentistry has a lot to do with the area you're practicing in, and, just what's customarily associated with that area. Like I said, down here I do not do any silver fillings whatsoever. But, even when I was speaking to a lot of my friends who practice up there, silver filling is customarily routine. When I was taking some advanced courses at New York University, it's taught all the time. It's routine because they're very, very strong for the back teeth.
Now, is it possible to have gold fillings?
Yes, it is. And now what we do with a gold filling is an indirect restoration. A gold filling is not direct. Gold filling is not like putting in an amalgam filling. An amalgam filling, you put it in the machine, it mixes up, and then, you just compact it into the tooth. A gold filling, what you would do, where you see people with gold, is we prepare the tooth, we take an impression, we send it to the laboratory, and it comes back, and then we cement the gold in. Gold is, a very, very strong filling. Gold is, significantly stronger even than silver.
But I guess it's more expensive. Is that why?
Yes. And I always tell my patients, I even just had a patient today that wanted some gold work, and I told my patient it depends when you do the gold where we can let you know what the price is, because it always depends on the price of gold. The price of gold is fluctuating all the time. So, if you decide you want to do this in a month, in 2 months, the price, basically whatever the lab says, is what the price is going to be.
Yeah.
So, really, gold have the highest strength and the toughness, and it really resists a lot of fracture, a lot of wear. I have patients that had gold put in 20, 30 years ago, and those, unless they get decay underneath it, and that depends how good the margins are and how good the seal is, that gold is going no place. And the other nice thing that I really like about gold is it's very gentle to the opposing teeth. So you don't really have the wear you have on the other teeth. But the only problem with gold is the color is not the most pleasing.
That brings up another subject. Now, there are certain minorities who seem to like gold even on their front teeth that show.
Yes.
What, is that to show that it's wealth? What is that all about?
It could be a sign of wealth. It could just be something, it may be ethnic. It's just something that they like. I had a patient that she had 4 gold crowns on her front teeth. And they were done 20 years ago.
Mm-hmm.
And I don't like to convince a patient to do one thing or the other. I tell them, we don't know what's going on under that gold. And, sometimes they say, okay, we want to have her removed, sometimes we want to keep it on. There's no rhyme or reason. I think they do it a lot of times. Now, I don't have a lot of people who want to do this right now today. But a lot of people do it when they're younger. They do it when they're younger. They think it looks cool to have, the grill, as they call it. It's That's what it's called, a grill.
Okay.
They have a grill. They put it on their front teeth, and it looks cool, when they're younger and they're walking around with the gold teeth on their, on their front of their mouth, and they're smiling and everything. But, as you grow older, it's not something you can take off easily. It's like a tattoo. When you have a tattoo, you have to be careful what you put on your skin, because you can't it's not henna. You can't just wash it off.
True. Well, right after, I'm going to ask you a question about the gold and when someone dies, how people have taken gold out of people's mouths. But I want to first introduce you again. I am talking with Dr. Rosemary in the afternoon. It's Dr. Rosemary Mencia, and she is part of the Adult and Geriatric Medical Center there in Fort Lauderdale off East Commercial Boulevard. I'm going to give you a number to call. It's 954-489-1345. Just get your pencils out. If you want to go to a dentist that's caring, that's absolutely just bright as can be, you'll want to go to Dr. Rosemary. And let me also say that Dr. Rosemary is offering a free dental cleaning, and that's worth about $125. Yeah. And that's the nicest thing that any dentist could ever do. And she and the whole staff there at the medical center, at the Adult and Geriatric Medical Center, they are just the sweetest, the nicest people. They're so caring. And while you're there are other people in the medical field that you may want to visit, and Dr. Rosemary can certainly make those appointments for you. But in the meantime, just call for an appointment at 954-489-1345. Get yourself your free dental cleaning, and it's just amazing that she's offering that. So, okay, now what I want to ask you about the gold is we have heard that when people pass away, and maybe it doesn't happen now, that people would take the gold out of their teeth.
Well, when patients pass away, I don't know how they get the gold out of their teeth. What happens usually, if a patient comes to the office and they're having gold crowns removed, to have a new crown removed or whatever the case may be, we'll give them their gold back. Okay, and then they can go and they can, if it's real gold, usually it's not a real gold, because, real gold can be very, very soft, and that would be very hard to keep that in your mouth. Usually it's an alloy, so it's a mixture of something. So it's usually not worth too much money. But we always give the gold back, to the patients. And, they can go and they can do with it as they please. So, if a patient is dead, how can they get the gold out of their mouth?
Well, I guess maybe they take their teeth out. I don't know. But that was always...
No. The way, if the patient, like I said, is coming and they're getting old, new bridge work, then I've had even patients that are having porcelain, are having just a regular bridge that is porcelain with metal underneath. They've asked for that bridge back. And there's no gold in it. There's nothing in it. It's not worth anything, not even worth a penny. And they've asked for that back.
Well,
and I tell them it's not worth anything, but they want it back, so we give it back to them. It's going to go in the trash.
Why don't you go ahead, and you just brought us a good point up on porcelain with metal. Now, porcelain is required on the outside, but the metal is what holds it in?
Well, that's if you have a bridge. If you have a bridge to replace, let's say, a missing tooth. You have a missing tooth in the middle, and you have a tooth to the front and the back of it, and you want to replace that missing space. An option is to have a bridge, which is 3 crowns, which are soldered together or cemented together in the laboratory. That kind of a bridge is, you can have it either all porcelain, or you can have porcelain put on top of a high noble metal. And the metal is what gives that bridge strength. And depending whether or not we put metal in it or we don't put metal will depend how much tooth structure is there, the condition of the teeth, the location, so on and so forth. Usually if it's in the front of the mouth, we won't put any metal, because sometimes when you see people smiling, you'll see they smile and there's like a black line by the gum line. And the reason you see that black line, usually that's the metal under the crown showing. So that's why in the front, usually we don't like to use metal underneath it, because we don't ever want that black line showing. We want it to be all porcelain. But in the back, sometimes we will use metal, just sometimes so there is strength. But again, if the patient tells us that they want it to be all porcelain, then there's no problem.
Well, let's. I think all of this conversation is very interesting for people who have no idea when they have a filling what to do. Do they leave it up to you? They come in and they have to have a filling. Do you then give them the different varieties of what they can do?
Always. When a patient comes in and they tell me that, I feel I have a broken tooth or a chipped filling or whatnot, we'll look, and depending on what size of filling is broken, we will then let them know what they can do. If it's a huge filling that's broken, there are limited options, because at that point, they more than likely need a crown if it's a big filling that's broken, because once you have a big filling that broke, once you remove the filling, and then you have to remove a little tooth structure as well just to give it a little bit of retention, you don't have a lot of room to put another filling in, because usually those big fillings that break have been in there for so many years. If it's a small filling that broke, then maybe we can just replace it with another filling. And again, in our office and down here in the South, most doctors are doing white fillings. Most of them are all doing composite fillings. So that's usually what we're going to replace the filling with. Again, unless it's a deep filling, and then, the patient, you feel that, maybe they're going to have too much sensitivity from a white filling or whatnot, then we may give them some other options that maybe they would benefit from a crown, or they might benefit from an inlay or an onlay, which, again, these are indirect restorations, which they might require an impression, and then they have to come back to get the restoration cemented on.
Now, you said something about sensitivity. That's interesting. We've never talked about teeth sensitivity, and I think you mentioned it if someone has the white filling.
Yes. One of the big side effects of white fillings is sensitivity. And that's something that they are working on every day, and they are getting better all the time. White fillings from 5 years ago are not as good as they are today, and they're significantly getting better and better. And I think 5 years from now, they're going to be even better every time they're coming out with a new generation of restorative material. And each generation of filling material, the number one thing they advertise to dentists is no sensitivity, zero sensitivity. You can open any dental journal you want, and the number one thing you're going to see is zero sensitivity, because that is the number one thing. Anytime, I do a filling on a patient, I'm going to let them know is you're going to have sensitivity to hot and cold. So they're aware of it, because when you didn't have sensitivity on a tooth and now all of a sudden you have sensitivity, that's something you're going to say, whoa, what just happened to me? And it's not from anything else, but it's the material. It's just the fact and the composition and the chemistry of these materials that causes this sensitivity reaction. The white fillings, which is sometimes the reason why, a silver was so much easier to use. The white fillings are so technique sensitive. You need really a very dry environment. You need almost just completely dry. And of course we all know the mouth is not dry. So any kind of saliva, any kind of moisture, anything really just makes it so much more difficult to do. And anything like that can cause sensitivity. And then the materials, just by their very nature, they're acidic, then there's different compositions. All of that, just the different steps involved, can add incrementally sensitivity to the tooth. So everything that we do, and, the restoration that we're doing, we're drilling the tooth, all of these things and the trauma we're adding to the tooth, followed by the steps we do to fill the tooth, all of these things is what's adding sensitivity to a tooth, whereas with the silver, we don't have this. We just drill the tooth, we take out the cavity, we put the filling material there, and that's it. You may have a little sensitivity for a few hours, maybe a day, but that was it. We never really have problems like this. And that's why they were used for centuries and centuries and centuries, and there were never any problems with it. I mean, I've had patients where I've had to take out white filling and put in silver filling because they've had sensitivity with white fillings. And when I put the silver filling in, there was never any sensitivity.
Oh, this is a whole subject. I just love this. I'm so glad that you just know about so much. This is Dr. Rosemary and Dr. Rosemary in the afternoon. And coming up, though, next week, you will be able to hear Dr. Rosemary from 6:30 to 7 on WSBR AM 740. And we're looking forward to that. So make sure that you put that on your calendar, starting with March. On the Saturday, you will hear her. It will be the same Dr. Rosemary, it's just going to be a different time, and we're happy that she's going to be doing that with us. Now, Dr. Rosemary, let me give her number also for those of you. We just announced, of course, that you can have a complimentary cleaning of your teeth, which is brilliant, which is wonderful, that a dentist here in South Florida would even do that, and that's 954-489-1345. 954-489-1345. It's worth about $125. She's a kind of a dentist that just wants to help everybody, and she knows there are a lot of people there who just are not getting their teeth clean. Maybe you're afraid of a dentist for whatever reason. Just go and meet Dr. Rosemary and the whole office staff there. I think you'll be so pleased. Of course, you've been hearing her on the radio, and you can just tell what a kind, wonderful woman she is, but she's so smart. That's what you can really hear with all this. Well, I'm glad you're talking about the fillings, because there are so many problems when people don't get their teeth filled. We talked about this before, I think. If they let things go, it becomes then a root canal job, right?
Right, absolutely.
So but fillings, how does someone know they even need a filling?
Well, like I said before, you might feel a rough edge. You might feel that you chipped the filling. You might feel that you chipped your tooth, that you broke a piece of your tooth off. That's what you might feel. Or if you floss your tooth, which we all should be flossing twice a day. But when you're flossing, you might feel that the floss is now getting caught someplace where it was not getting caught before. You may feel sensitivity or pain when you're flossing all of a sudden. You may feel a twinge to hot and cold, which you were not feeling before. Or the classic when you eat sweets. Oh, it hurts now when I eat sweets. That's a sign that something is going on. Anything that is new, something that you're feeling that you were not feeling before, is a sign that there's something going on that needs to be looked at.
And can someone stave off having fillings by just taking very good care of their teeth? I don't mean fillings, but to have cavities. I mean, are there people you've ever met that have never had a cavity?
Yes. Yes. Because there is a genetic component to it, and some people just are genetically predispositioned to have good teeth. And they have very strong enamel. And then just like there's some people who are genetically predispositioned to have softer enamel. And, they get a lot of decay and their enamel is much softer. So, yes, there is. But how does somebody stave off from having decay and having fillings? By following good oral hygiene, brushing your teeth twice a day, flossing. And a lot of people, they brush their teeth. And then a lot of times you hear people, they have snacks at night before they go to sleep. They get a craving for sweets. How many people do we hear? Right before they sleep at 9 o'clock, 9:30, they have to have a cookie or they have to have a little ice cream. They have to have something right before they sleep. But how many people, after they have that little sweet, do they go and do they brush their teeth again? They don't do that because they say, oh, I've already brushed my teeth already. I'm just going to sleep now. But what you just ate, even if you just had another cup of coffee or even if you just had a glass of juice or something, if you don't brush your teeth right before you go to sleep, then whatever you just ate or drank is bathing your teeth in that sugar all night.
Well, you don't know this, Dr. Rosemary, but ever since you told us this, and you did on one of your previous shows, I have become religious. Every night before I go to bed, I don't do it to the very last thing. I brush my teeth at night instead of doing it earlier and then not doing it if I've eaten something. So I wait to the very last minute, I brush my teeth, and then, of course, I brush it again in the morning. So thank you very much. You've really helped me.
You're welcome. That's so important. I hear so many people, they brush, Then they go and they'll watch TV, whatnot. And then right before they go to bed, they have a glass of milk. Or they'll eat just one cookie. And they don't think because they don't consider it eating. It's subconscious. Oh, I just took a bite of something. But then they're sleeping. And then all of that sugar, even in a glass of milk, even a glass of skim milk has sugar in it. And that is bathing your teeth. All of those acids, all of that sugar, like we spoke on one of my previous shows, those acids are bathing your teeth all night. That's how you're getting decay. The best thing to do is you brush, you floss, you use a mouthwash, and you go to sleep with a clean mouth. And then when you wake up, you can have coffee if you want. You can do whatever you want, but then you brush your teeth. You can brush first thing you wake up, after you have your coffee. That doesn't matter. But at least you're brushing your teeth. The most important thing is brushing right before you sleep, and then you don't put anything else in your mouth. If you want to drink water, that's okay because water is very neutral.
Well, now, let me ask you then, what about tea? A lot of times at night before I go to bed, I have a cup of tea without sugar. Would that also be damaging if I didn't brush my teeth?
Yeah, it would be because the same thing. Tea, even if it doesn't have outward sugar, there's other things in it. It's the same thing. The only thing that you can go and you can have after you brush your teeth is plain water. Mm-hmm. Because the tea have coloring in it, right? Mm-hmm. It has coloring in it.
Right.
So it's the same thing. That could stain your teeth.
Okay, so that's very important information. That's
the only thing is plain water.
We certainly learn a lot about your... and of course, you've instilled this in your daughters and your husband, I'm sure, so everybody has a teeth inspection, right?
Oh, I make my kids get out of bed. Because my kids sometimes, they're tired. They're really tired when they go to sleep. And they're just like, Mommy, we brushed our teeth already. We're tired. And, they may not have even eaten anything. They just may have had a glass of milk. I'm like, no, stand up. And I'll, hold them behind them at the sink. And I'm like, brush. And they're so
funny.
Brushing because they're tired. I'm like, no, brush.
You're
because,
great.
Otherwise that glass of milk that they just had, and I just leave water next to them. Near their bedside, they only have water. And even from a young age, they never drink juice at night, none of that stuff.
Well, you've helped me, and I know you've helped all our listeners. And thank you very much, Dr. Rosemary. So don't forget, next week, beginning of March, on Saturday, you're going to be hearing Dr. Rosemary in the morning, and that's going to be from 6:30 to 7 on WSBR AM 740. And also remember, she's so kindly offered a complimentary teeth cleaning valued about $125. Just give her a call, and the phone number is 954-489-1345. That's 489-1345. Thank you, Dr. Rosemary.
Thank you, Anita. It was great.
Talk to you again.
Take care. Bye-bye.
Bye.